I'm Dr. Stephanie Sisler, pediatrician and owner of Lovelight Pediatrics located in Oakland. Our office opened in April of 2019, and we've been thrilled to offer board-certified pediatric care to local patients. We do see children from birth to age 21 and provide both well care and acute care. We provide in-house finger stick testing for both lead and hemoglobin. We also provide a computerized visual photo screen to assess for vision problems in infants. In addition to that, we see both physical and mental health care needs, so we provide screenings and treatment for depression, anxiety, and attentional needs. In addition to that, we do provide sterilized ear piercing for a safe option for those families who would like to have their children's ears pierced. We're often asked the difference between a family physician and a pediatrician. So while family doctors are trained to care for folks throughout their lifespan, so from birth all the way to elderly, they often also have some obstetrical training for pregnancy care. Pediatricians spend their entire training focused just on children. We spend an extensive amount of time with GI doctors, heart doctors, lung doctors, all in the pediatric field. And so that gives us specialized training that allows us to best care for children throughout their growing years. I did want to talk a little bit about the difference in a well child visit and a sports physical. Right now it's fall, many sports are starting to reopen and to start up with practices. So many children are headed to sports physicals to be evaluated. These can be an important part of your child's clearance for sports. They focus in particular on identifying any risks that your child may have as they participate in physical activity. They focus mainly on heart, lung, and musculoskeletal exams. So they are important, and it's important to have those things checked prior to sports activities. However, they are not the same thing as a well child visit. Well child care involves following a child over time, monitoring their growth, both height, weight, and some other parameters, as well as looking at their development and their social functioning. We do many screens at well child visits, including looking for risks for medical disease. Is your child at risk for early heart disease? Is your child at risk for certain types of infections? The other thing that's important, especially in the preteen and teenage age group, is to do routine screenings for mental health disorders. Even now, we are seeing rising numbers of anxiety and depression and stress levels in our preteen and teenage populations. And so with that, it becomes even more important that children are seeing someone outside of a parent who can talk with them about any potential symptoms or struggles that they're going through and try and help provide treatment for that. So whether your child gets a sports physical or not this fall, we highly encourage you to stay up to date on well child visits with your child's PCP. Thanks for listening and have a great week.